Hi, my name is Deanna Harris, and this video is for wound care for nursing 224 Fundies 1. So what I will do is I will come in, I will introduce myself. Hi, my name is Deanna. I'll be your nurse for today. Can you please state your name and your date of birth? Okay, great. So I am just here to verify orders of a wound care dressing change. Are you in any pain right now? Okay. And are you allergic to anything right at this moment that you know of? Okay, great. So if they tell me no about the pain level and that they're not allergic, then I'll go ahead and give them privacy, and then I will let them know and discuss what we're going to do. And I will also clean my surface area off, and I will let them know by saying I'm going to change their wound care dressing. And what's going to happen is I'm going to take the old dressing off. I'm going to assess it and measure it, make sure that there's no infection there, make sure that it's healing properly. And then I'm going to clean it with solution, and then we're going to pack it with new packaging. Ask them if they have any questions, and then ask them, is it okay if I start? Is it okay if I go ahead and do the wound care? If they say yes, then I'll go ahead and I'll raise the bed up to a hip level, and then I will gather my belongings that I need, my supplies, make sure that the trash can is near me. And then after that, I will perform hand hygiene. So after the hand hygiene, I'll go ahead and put on some non-sterile gloves. And then I'll go ahead and prepare my supplies, like my Q-tip and my measurement stick and things of that nature. And then after that, I will go ahead and put a chuck under the patient so no drainage will come through. And then after that, I will remove the old wound dressing, and I will assess it for coca. I will assess for color. I will assess for odor, consistency, and amount. And then after that, I will also assess for eschar, making sure that there's no necrotic tissue, making sure that there's no infection there. And then once I do that, I will go ahead with my gloves on and take my measuring device. And here's my wound. There's my wound. And then I will go ahead and measure it from top to bottom. And then I will go ahead and measure from the side for width. And then I'll discard that over there. Then I'll take a Q-tip or cotton tip applicator, and I will go in depth and make sure that there's no tunneling there, and there's no tunneling. And then I will also take the measuring stick and then measure the depth. Then I'll go ahead and put that over there, dispose that in the appropriate containers. Then I'll go ahead and remove these gloves here and put them in the proper container. Then I'll go ahead and perform, hand hygiene again. And then once I perform hand hygiene again, I'll go ahead and get the things from my tray that I will need. I will open up my container. I will take my gloves, my sterile gloves, and I'll take them off near my sterile field. I would then also take the solution, check the expiration date on it, And then if it has not expired, I'll go ahead and pour up to 35 milliliters of solution in there and set that off to the side of my sterile field. Next, I will go ahead and grab my sterile gloves. And since this right here is not sterile, I can take these and unfold it. Then I will take my dominant hand and put my glove on. I'll reach for the cuff, the inside of the cuff here. And then I will hitchhiker thumb and grab my other glove and stick my other hand in here. Now, this glove here is torn. However, I know that if I was in a medical facility, if I had a torn glove, I would have to start all over. But for educational purposes, this is the only one that I have. So, and I'll don them like this. And if I want to throw or dispose this away, I would dispose it from the middle and take it off of my, take it away from me. Now that I have on sterile gloves, I can touch everything that's sterile. So I would then take some of my gauze and put that inside my solution and let that soak. And then once that happens, I can then grab one with my sterile hand and drop it into my clean hand. And then I will go ahead and go vertically. And then I will throw that one away. Take another one. And you do this, drop it. You will do this until you see clear drainage. And so drop it again. And then you'll just note to the patient that it is clear. The drainage is clear. And now what you do is you take a dry one and then you take a Q-tip, put it in your clean hand. Then you take a dry gauze and you place it on the wound. And then you use that to pack it, help you pack it. And then you dispose of that. And then you take another dry one, drop it, and just pat dry around the area, surface, to make sure that you can tape it. And now you'll take the pad and you'll place the pad on the wound. And then you will take your tape around the area. You will then take your label, place it on the wound or the tape, and you put the date, the time, and your initials. You let the patient know that you're all done. Ask them if they are comfortable with their pain level, just making sure that their pain is reassessed. And then you will take off your PPE equipment, starting with your gloves. And so you can just pinch here. either. Do that, and then come back under here and dispose in the proper area. Take your gown off. You can roll it away from you. And then dispose of that. Ask the patient if they're okay. You will make sure that the bed rails are locked. You'll put the bed back down, and then you will perform hand hygiene. And then that will complete the wound care assessment.